Hi, welcome to episode 3 of the Medicare Hat Lady. I'm Jennifer Chumbley Hogue, KG Health Insurance. We're glad you're with us today. Medicare in the news. This week, insurance agents got a $100 per year raise for Medicare Advantage and standalone Part D direct plans. It's important that you know about this because Medicare Advantage plans pay approximately 3 times as much as Medicare supplements, also known as Medigap. When you're talking to an agent, make sure that they are presenting to you both Medicare Advantage plan options and Medicare Supplement with Part D options. If they're only showing one of them, it's time to find a new agent. Welcome to the education segment. This week, we're talking about more crazy letters. Last week, we talked about Part A, B, C, and D. Part A covers hospitals. Part B covers your doctors. A and B together are called Original Medicare. Part C is Medicare Advantage plans, and Part D is prescriptions. But this week, we're going to talk about the 3 main Medicare Supplement plans. Medicare Supplement is just the same as Medigap. It's like saying Pop in Iowa, Coke in Dallas. Totally different words that mean the same thing. Plan F, you had to be born before January 1st, 1955, or eligible for Part A prior to January 1st of 2020. So that would be for people disabled. Plan F covers 100% of medical expenses without a deductible. Plan G as in go covers 100% of medical expenses after the Part B as in boy deductible. The Part B deductible in 2024 is $240. Obviously, it goes up every year, and it's always announced after Election Day in November. Plan N as in Nancy, still a Medicare supplement, and it covers 100% of your medical expenses after the $240 Part B deductible and has $20 office visit copays, $50 emergency room copays, and does not cover excess charges. We're going to dive into excess charges next week in episode 4, but for today, excess charges are for doctors or hospitals that do not accept Medicare assignment and have not legally opted out. So the 3 main Medicare supplements, Plan F covers 100% of your medical expenses. Plan G covers 100% of your medical expenses after the Part B deductible. And Plan N covers 100% after your medical expenses after the Part B deductible with $20 office visit copays, $50 emergency room copays, and does not cover excess charges. This week's frequently asked question, what's up with my wrist? Well, they say to get exercise, so I was getting exercise. I was walking the dog. The sidewalk jumped up and bit me. I fell on my wrist, broke my wrist in multiple places, had surgery, and now I'm on the mend. Physical therapy starts in a couple weeks, but I really appreciate all the kind words and messages, giving me good healing thoughts. In this week's word of the day, we're back to initials of the day, because apparently everything that comes out of Washington, D.C. is initial. And this week, we're going to talk about the initial election period, IEP for short. The initial election period is the 3 months before you turn 65, the month you turn 65, and 3 months after. During this time, you can sign up for Parts A and B without a late enrollment penalty. We talked about late enrollment penalties for Part B last week, but just remember, if you have active, credible coverage at an employer with more than 20 employees, you will not be subject to the Part B penalty later. During the initial election period, you can enroll in a Medicare Advantage plan with or without drug coverage, a standalone drug plan, and a Medicare supplement plan without underwriting. It's very, very important that you remember, if you choose a Medicare Advantage plan when initially enrolling in Part B, that after the first 6 months, in most states, it does require underwriting to move from Medicare Advantage to Medicare Supplement. The annual election period, another great initial, which we'll talk more about next week, from October 1st to December 7th, is not open enrollment. It does not give you freedom of choice like you had at your employer to switch plans. After your first 6 months of Part B, if you want to switch from a Medicare Advantage plan to a Medicare supplement, it does require underwriting. Thanks so much for tuning in to this week's edition with the Medicare Hat Lady. Next week, I'll be coming at you from Sedona, where we're going to talk about excess charges because in Arizona, it can play a significant role in your Medicare coverage. See you next week.